सहनावतु सहनो भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्वेषावहै शांति 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 योगेन चित्तस्य पादेन वाचम् आलं शरीरस्य च वेदकेन जोपाकरोत्तम प्रभोरं मुनीन् पतञ्जलिन् प्राणजलिरान तस्मै ॐ शान्ति 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 When it's little warm, gently attach the ball. Okay. लास्ट डे हम लोग जहाँ से कंप्लीट किए थे वहां से ही आज हम लोग फिर कंटिन्यू करते हैं. न्यूरोमास्कुलर ट्रांसमिशन. Neuromuscular transmission occurs by a fairly simple and straightforward mechanism. The nerve synthesizes alkaline and store it in small, uniformly sized package called vessels. Stimulation of nerve causes these vessels to migrate to the surface of the nerve. Rupture and discharge line into the cleft spring the nerve form muscles. Hers is the in palate of the muscle respond by opening their channel for influx of sodium ions into the muscle to depolarize the muscle. The in palate potential creates is continue along the muscle membrane by the opening of sodium channel present through muscle membrane to initiate a muscle contraction. मतलब एक muscle दूसरे muscle को कैसे engage करते हैं, that is the main things. और यहाँ पे हम लोग उसी को जानने की थोड़ा प्रयत्न कर रहे हैं. The acetylcholine immediately detach from the receptor and is destroyed by the enzyme. Acetylcholine, which is also present in the cleft, exogenous drug that activate nicotinic agents, that is agonists such depolarize muscle relax, can also act on these reports and mimic the effect of acetylcholine and cause depolarization of in palate. Non-depolarized muscle relax in DMRS also act as on the receptor, but they prevent acetylcholine from binding to the receptor and thus prevent deep depolarization by agonist, because this NDMRs prevents the action of agonist. They belong to class of compound known as antagonist. At the muscle, ACRA, other compound frequently called reversal drugs or antagonist of neuromuscular paralysis, inhibit acetylcholine and therefore impair the hydrolysis and acetylcholine. The increased accumulation of undergoing acetylcholine can effectively compete with NDMRs and thereby displace later from the receptor. That is law of mass action and antagonize the effect of NDMRs. Neuromuscular uh, transmission, it is very uh, interesting part to see or to know. अभी इसके हम लोग with audio visual भी देख लेंगे, so it will help us to
hire 4 different people for 4 different roles in your business.
A skeletal muscle contracts only when stimulated by nerve impulses from a motor neuron. Without innervation, muscles become paralyzed and eventually atrophied. The axon of a motor neuron usually gives out many branches, supplying multiple muscle fibers. These fibers contract in unison when activated and constitute a motor unit. A motor unit can contain anywhere from just a few muscle fibers to thousands of them. Small motor units are found in muscles that require finer control. For example, muscles that are responsible for subtle movements of the eyes. Large motor units are found in larger muscles that require strength, such as muscles of the arms and legs. Muscle fibers of the same motor unit are usually not clustered together, but scattered throughout the muscle. This way, stimulation of a motor unit has a slight but uniform effect on the whole muscle, and not causing a small, localized twitch. The strength of a muscle contraction is determined by the number of motor units that are activated at one time. Even at rest, most muscles are in a partial contraction state called muscle tonus, which is maintained by alternating activation of a small number of motor units. The connection between a motor neuron and a muscle fiber is called a neuromuscular junction, which is basically a chemical synapse between the nerve terminal and a specialized area of muscle cell membrane called the motor end plate. When an action potential reaches the nerve terminal, it causes the release of the neurotransmitter acetylcholine into the synaptic space. Acetylcholine then binds to nicotinic receptors on the end plate. Nicotinic receptors are ligand-gated ion channels. Upon binding to acetylcholine, they open to allow sodium to enter the cells, depolarizing the cell membrane, producing the so-called end plate potential. An action potential is generated in the muscle cell only when the end plate potential reaches the threshold required to activate voltage-gated sodium channels located outside the end plate, in the neighboring membrane. When activated, these channels allow faster influx of sodium, further depolarizing and eventually reversing the polarity of the cell membrane. At this point, voltage-gated potassium channels open for potassium to move out, quickly returning membrane voltage to its original resting value. Once generated, the action potential spreads like a wave, thanks to similar voltage-gated ion channels located throughout the muscle fiber. The action potential also runs deep into the fiber via T-tubules to reach the sarcoplasmic reticulum. Here it activates voltage-gated calcium channels, releasing calcium from the sarcoplasmic reticulum into the cytosol of muscle cells. Calcium then sets off muscle contraction by the sliding filament mechanism. This mechanism is described in another video. Another important component of the neuromuscular junction is the enzyme acetylcholinesterase. This enzyme removes all acetylcholine molecules that do not immediately bind with the receptor and those that are done activating a receptor. The enzyme action essentially terminates synaptic activation, giving the muscle time to relax and thus preventing continuous contraction that would result in muscle spasms. Substances that cause muscle weakness or paralysis do so by interfering with the function of neuromuscular junction. Botulinum toxin prevents acetylcholine release from the presynaptic side of the junction. Some other toxins attach to nicotinic receptors, blocking acetylcholine from binding but do not open the ion channel. Certain drugs lodge into the channel of nicotinic receptor, blocking the passage of sodium. All these substances prevent activation of muscle cells and cause flaccid paralysis. On the other hand, some pesticides inhibit acetylcholinesterase, preventing degradation of acetylcholine, causing continuous activation of muscles. That's how they induce muscle spasms and cause spastic paralysis.
Pilumani and Subhiji, any question?
No, sir.
Okay.
No, sir.
क्योंकि हर एक पार्ट को ऐसे ऑडिविजुअली हम लोग देखेंगे सो दैट एवरीथिंग मतलब जैसे ऐसे यहाँ पे ये हम लोग एनाटॉमी फिजियोलॉजी पढ़ रहे हैं तो इसमें कोई मतलब एक विजुअलिटी रहे सो दैट व्हेन यू आर गोइंग टू थिंक अबाउट दैट थेरेपी तो तब हर एक जितना भी पार्ट है वो हम लोगों को इजीली समझ में आ जाए इस रूप से हम लोगों को करना है ठीक है
Okay, sir.
ligaments tendons skeleton bones types structure and function spinal column junction types structure functions okay first is ligament what is ligament ligament though fibrous band of connective tissue that serves to support the internal organs and hold bones together in proper articulation at the joints. At ligament in is composed of dense fibrous bundles of collagenous fibers and spindle shape cell known as fibrocyte with little around substance J component of the various ligaments through fibrous band connective tissue that serves to support the internal organs and hold bones together in proper articulation at the junction. At ligament, it composed of dense fibrous bundles of collagenous fibers and spindle shape cell known as fibrosides with little ground substance, a gel-like compound of the various connective tissue. Some ligaments are rich in collagenous fibers, which are sturdy and elastic, whereas other rich in elastic fibers, which are quite tough, even though they allows elastic movement at junction ligaments from a capsular sac that encloses the articulation bone ends and a lubricating membrane. The synovial membrane, sometimes the structure includes a rescues or pouch lined by synovial tissue. This is called a brusa. Other ligaments fasten around or across bone ends in bands, um, permitting varying degree of movement or act as tie pieces between bones, such as the ribs or the bone of forearm, restricting inappropriate movement. Okay, so we'll see how ligament is working in our body. क्योंकि जैसे लिगामेंट के बारे में तो अभी हम लोग जान लिए हैं, बट वो लिगामेंट हाउ एग्जैक्टली इट इज वर्किंग वो भी एक बार वीडियो के द्वारा एक बार देख लेते हैं.
Just $67. You can make as many videos as you want, and you never need to pick up a.
There are four major ligaments that stabilize the knee. The medial collateral ligament is on the inner side of the knee, and the lateral collateral ligament on the outer side. The collateral ligaments give sideways stability to the knee. Two ligaments cross in the center of the knee. They are called the cruciate ligaments. The ligament toward the front is the anterior cruciate ligament, or ACL, and the one towards the back is the posterior cruciate ligament. The ACL prevents the lower bone, the tibia, from moving forward, and the PCL prevents it from moving backward. If the ACL tears, the tibia can move forward too much, and the knee can be unstable. The knee in which the ACL is torn tends to give out when pivoting or quickly changing direction. To correct this instability, a new ACL can be made. The strongest graft that is available to replace the torn ACL is the middle third of the patella tendon. This graft has a plug of bone taken from the patella or kneecap on one end and from the tibia on the other end. These plugs of bone are important because they provide solid fixation of the graft. This animation will explain how the middle third of the patella tendon is used to reconstruct a torn anterior cruciate ligament.
So we have seen it as a graphically कि कैसे एक ligaments वो काम करते हैं, वही हम लोग ये इसमें पढ़ाई भी किए हैं. Now we'll move to tendon. Tendon or sinew is a touch, high tensile strength band of dense fibrous connective tissue that connects muscles to bone. It is able to efficiently transmit the mechanical force of muscle contraction to the skeletal system without sacrificing its ability to withstand significant amount of tension. Tension are similar to ligament. Both are made of collagen. Ligament connect to the bones to another, while tendons connect muscle to bone. So लिगामेंट क्या कनेक्ट करते हैं? बोन टू, मतलब वन बोन टू अनदर बोन. और टेंडन क्या कनेक्ट करते हैं? मसल टू मसल से बोन में जो कनेक्शन है दैट इज बाय टेंडन. और लिगामेंट्स क्या है? बोन टू अनदर बोन. ये दैट इज वो लिगामेंट का काम, और ये है टेंडन्स का काम. टेंडन्स का स्ट्रक्चर क्या है? टेंडन्स consist of dense regular connective tissue. The main cellular component of tendons are specialized fibroblasts called tendon cells, tenocytes synthesis the extracellular matrix of tendons, abundant in densely collagen fiber. The collagen fibers are parallel to each other and organized into tendon fascicles. Individual fascicles are bound by tendinium, delicate, loose connective tissue connecting thin collagen fibers and elastic fibers. Groups of fascicles are bounded by epistone, which is celled of dense irregular connective tissue. The whole tendon is enclosed by fascia. The space between fascia and the tendon tissue is filled with paratendon, a fatty alveolar tissue. Normal healthy tendons are anchored to bone by shapy fibers. Cellular वो कैसे बनते हैं वो एक बार देख लेते हैं. The dry mass normal tendons which make up 30 to 45% of total mass is composed of 60 to 80% collagen, 60 to 80% collagen 1 to 2% collagen 3, and 2% collagen 4. Small amount of collagen 5, 6, and others. 40, 40 non-collagen extracellular matrix compound, including 3% cartilage, oligomic, oligomic matrix protein, 1 to 2% elastin, 1 to 0.2% ironogenic components such as copper, manganese, and calcium. While type 1 collagen is the most of collagen tendency, minor collagen are proteins that play a vital role in proper tissue development and these include type 2 collagen in cartilaginous zone. Type 3 collagen is the reticulin fiber of the vascular wall. Type 9 collagen. Type 4 collagen is basement membrane of the capillaries. Type 5 collagen is the vascular wall, and type X collagen in the mineralized fibrocartilage near the interface the bone. Alter structure and collagen synthesis. Collagen in the tendons are held together with osteoglycan compound consisting of a bundle of glycoaminoglobulin group present especially in connective tissue compound between and is comprised religions of tendons adhesion which are capable of binding to the collagen fibers at the specific location. Portfolio are interwoven with the collagen fibers. Their glycominological side chains have multiple interaction with the surface of fibrous so that the host is important structurally in the interconnection of fibrous tenocytes. अच्छा टेंडेंस के पहले ये इसके बारे में टेंडेंस के बारे में एक बार देख लेते हैं.
those tendons.
Tendon basics.
The tendons are connective tissue made up mostly of collagen, and that's somewhat like ligaments and fascia. Now, let's get this out of the way from the beginning so that there's no confusion. Ligaments connect bone to bone, fascia connect muscle to muscle, tendons connect muscle to bone. You see, when you move your bones, you contract your muscles. But it's not your muscles that pull on that bone, it's your tendons. All the force goes through the tendons, and that means they have to be extremely strong. But tendons aren't just these strong, static tissues, they also have elastic properties. So if you're jumping or running, they work a bit like a spring, storing some of the energy and releasing it on the upward bound. And that's pretty cool. Now let's look at the actual structure of a tendon. Each tendon, like this one, is made up of different bundles. Here's a bundle. There are bundles here, bundles here, bundles here, and finally, here is the collagen fibril. If you have a healthy tendon, it looks a bit like this, with these dense arrays of collagen fibers all parallel to each other. This structure keeps them strong. And opposite of healthy tendons are injured tendons, and tendon injuries are known as tendinopathies. Here's how this works. Tendons are meant to withstand a lot of repetitive loading, but if the load becomes too great, then the tendon gets stressed. They get micro tears. Most of the time, your body can repair these pretty easily, yet if the tendon is repeatedly strained so that the rate of degradation exceeds that of regeneration, that is where the problems start. Now, most of these tendon problems happen near the joints, such as the elbow, shoulder, knee, and ankle. Basically, areas where we put the most strain on. If you go to a doctor or health professional, you might hear different terms that describe tendon injuries. The most common term is tendinitis, which describes acute tendon injuries that lead to inflammation. Also, one of the most common things that aging athletes get. That inflamed tendon can hurt. Of course, we understand, right, that inflammation is also the body's natural healing response. Your body's working to heal that tendon, and it's totally normal. But we all want to get past that, right? So how do you heal it? Healing. The first step is to make sure you don't injure it more. That's where some degree of rest comes in. Essentially, change up the activities you're doing to put a bit less stress on that tendon. You don't have to totally stop exercising, and just so you know, the initial repair of that tendon will happen in a few days, but to permanently heal it may take more like 3 to 6 months. You just want to make sure you're not overstraining it again at this stage and permanently damaging the tendon. So you have to be a bit careful, and well, a good diagnosis from a doctor is going to help you know what's up. The next step is rehabbing it. Now, some of the best exercises at this stage are going to be eccentric style exercises. That means exercises where you're letting your muscle lengthen, like lowering a biceps curl. That's an eccentric motion. Lots of doctors now recommend moving, stretching, and gently massaging your tendon while it's healing. The goal of this is to make sure that your healing collagen fibers that make up your tendon end up laying down in the right direction, all parallel to each other, resulting in a strong, healthy tendon. And in the end, just remember that getting the right rehab schedule is really important to healing, and to do that, it's important to get a good diagnosis. If you don't think you're adept enough at diagnosing your own injury, then I highly recommend a good orthopedic doctor.
So, this is the main क्या बोलेंगे, things of tendons. Vijay, any question? Lemony?
No, sir.
No, sir. No. सर प्लीज रिकॉर्डिंग सर जल्दी भेज दीजिए, रिवाइज करना पड़ेगा, मेमोराइज करना
हाँ
इतना
हाँ हाँ हाँ
इजी नहीं है सर. ओके सर.
हाँ, क्योंकि ये सारा कुछ मेडिकल टर्म है, सो
हाँ सर.
हम लोग को इसको, इसीलिए हम थोड़ा धीरे धीरे भी आगे भी बढ़ेंगे, इतना जल्दी भी नहीं, क्योंकि नहीं
Okay.
ये 1 हफ्ता लग ही जाएगा कि टू मेमोराइज ऑल दोस थिंग्स एंड टू अंडरस्टैंड.
Okay, sir.
Then tenocytes. The tenocytes produce the collagen molecules which aggregate end to end and side to side to produce collagen fibrils. Fibril bundles are organized to form fibers with elongated tenocytes closely packed between them. There is a 3-dimensional network of cell process associated with collagen in the tendon. The cell communicate with each other through gap junction, and this signaling gives them the ability to detect and respond to mechanical load. Blood vessels may have visualized within the tendon running parallel to collagen fibers with occasional branches transverse anastomosis. The internal tendon bulk is uh, thought to contain to nerve fibers, but the epistone and paratendon contains nerve ending, while Golgi tendon organs are present at the mono my mytendinous junction between tendon and muscle. Tendon length varies in all major groups and from person to person. Tendon length is, in practice, the descending factors regarding actual and potential muscle size. For example, all other relevant biological factors bring equal a man with a shorter tendons and longer bicep muscles will have greater potential for muscle mass than a man with a longer tendon and shorter muscle. Successful bodybuilder will generally have shortened tendons connectively in sports requiring athletes to excel in actions such as running or jumping. It is beneficial to have longer than average Achilles tendons and shorter calf muscle. Tendons length is determined by genetic predisposition and has not been shown to either increase of or decrease in response to environment, unlike muscles which can be shortened by trauma, use, imbalances, and lack of recovery and stretching. Functions. Traditionally, tendons have been considered to be a mechanism by which muscles connect to bone as well as muscle itself. Functioning to transmit forces, this connection allows tendons to passively modulate force during locomotion, providing additional stability with no active work. However, over the past 2 decades, much research has focused on the elastic properties of some tendons and their abilities to function and as uh, springs. Not all tendons are required to perform the same functional role, with some predominantly positioning limbs, such as the fingers when writing, positional tendons, and other acting as a spring make the locomotive more efficient Energy storing tendons. Energy storing tendons can store and recover energy and at highest efficiency. For example, during human stride, the uh, Achilles tendon stretches and the ankle joint dorsiflexes during the last portion of the stride as the foot plantar flexes, pointing the toes down. The stored elastic energy is released. Furthermore, because the tendon structures, the muscle is able to function with leg or even no change in length, allowing the muscle to get more force. Healing. The tendons foot are high, complex, and interact. Therefore, the healing process for tendons is long, painful. Most people do not receive medical attention with the first 48 hours of injury, will suffer from severe swelling, pain, and burning sensation where the injury occur. Benefits of activity on healing. He effects on mechanical strain in the form of activity level on tendons injury and healing, while stretching can disrupt healing during the initial inflammatory phase. It has been shown that controlled movement of the tendons after about 1 week following an acute injury can help to promote the synthesis of collagen by tenocytes, leading to increased tensile strength and diameter of the healed tendons and fewer adhesions than tendons that are immobilized. In chronic tendon injury, mechanical uh, loading has also been shown to stimulate fibroblast proliferation and collagen synthesis along with the collagen realignment, all of promote repair and remodeling. So this is the all about function. अच्छा, so टेनोसाइटोसिस को लेके एक बार देख लेते हैं. What is tenocytosis? Which will help us to understand tenocytosis in detail.
Which is your favorite plant? I like aloe vera the most. We've got around 2 plants at home.
Welcome to this set of videos about tendon and ligament biomechanics. I'd like to thank Daryl Thalen, currently at the University of Wisconsin-Madison, who put together the first draft of these slides several years ago. Ligaments form the connections between a soft collagenous tissue. Ligaments are a soft collagenous tissue that connect bone to bone in the human body. And their function is primarily to augment joint stability, guide joint motion, and help with proprioception, knowing where the body is in space. Tendon, by contrast, which often gets lumped together with ligament when we're talking about tissue mechanics, are slightly different. They connect muscles to bones, and they are primarily to transmit muscle forces to the skeleton, also to promote joint stability, and to store and return elastic energy. They also provide force feedback to the nervous system via the Golgi tendon organs. But their mechanical properties of tendon and ligament are very, very similar, and so they're both collagenous soft tissues that have some similar challenges for repair and form an important part of the orthopedic orthopedic biomechanics due to their frequency of being torn and difficulty to repair effectively. So they really have similar structure and different function. But one is subjected to higher loads normally. I'll give you a second to think about which one and why. And the answer is tendon, normally subjected to higher loads because muscles create forces, and the tendons are their job is to transmit that force, apply that force to the bones. So, considering the structure of tendon and ligament. So tendon and ligaments are composed of 20% cellular material by volume, and that's primarily fibroblasts. In tendons, those are called tenocytes. And 80% of the extracellular matrix. So tendons are mostly extracellular matrix, which is comprised of 50 to 70% water, and then 30 to 45% of solids. Those solids are primarily type 1 collagen, between 60 and 80% type 1 collagen, and then elastin and proteoglycans form the rest of that kind of mixture, the solid. When we talk about the mechanical properties of tendon and ligament tissue, the molecule that we're most commonly talking about, or the part of the tendon that we're most commonly talking about, is collagen. Collagen is the most abundant protein in tendon, which is why we're talking about it, and it's made primarily of collagen molecules, tropocollagen. Tropocollagen is a triple helix of polypeptide strands, and each strand has the triple helix shape that's shown there with the red, green, and blue. And they're about 300 nanometers long by 1.5 nanometers in diameter. Collagen has 28 or more different types that are present in the human body, but most of the collagen is types 1 through 4. 90% of the collagen in the human body is types 1 through 4. Type 1 is the type of collagen found in bone and tendon, and type 2 is the type found in cartilage. Then the others, type 3 and 4, are found in the blood vessels. And collagen is what's responsible for giving tendon its tensile and ligament its tensile strength. So it's a very important part of the tendon and ligament. Here's a picture of the collagen fibrils and this repeating kind of structure that you see as they join together in a staggered pattern to make up the fibrils. The molecules have a positive head and a negative charge, which provides for cross-linking between the molecules as well as linking kind of links them along their lengths. And then the adjacent molecules are staggered, which gives the collagen a banded appearance in along the length of the ligament. Proteoglycans mixed in with this bind most of the extracellular water, which makes the matrix a structured gel-like material and provides lubrication between the microfibrils. So collagen fibrils can slide past each other a little bit, which is really important, again, for their mechanical properties and how they... Proteoglycans are a large complex molecule with a core protein, a strong negative charge, and they form the filler in most of the ECM and help to regulate the movement of molecules through the matrix. You can see here a picture of a proteoglycan, the hyaluronic acid chains along the sides of it. You can kind of get a sense of the core protein and how it might take up quite a bit of space in the body, molecularly speaking. Inside the tendon and ligament or in between the collagen fibrils, are tenocytes, which are responsible for mechanotransduction in the tendon. So that's providing information about force transmission for the proprioception in the body. And so tenocytes lie in longitudinal rows along the collagen fibrils. They respond to mechanical loading by stretching when they're in tension and compressing when they're in compression. And they also experience some shear stress via induced fluid flow as the water moves in and out of the tendon as it stretches and compresses. They have multiple extensions within the extracellular matrix, which allows them to communicate and helps with that kind of proprioception, knowing the feedback, the force feedback loops in the tendon. So they're primarily responsible for mechanotransduction, this knowing how much force and where and being able to self-regulate that. And finally, they mechanically induce production and degradation of the extracellular matrix. So they tell the tendon or the tissue when it's time to remodel. It gives tendon and ligament, so the collagen in particular gives tendon and ligament a hierarchical structure where you have tropocollagen, subfibrils, fibrils, fibers, proteoglycans in between the fibers, tenocytes also in between the fibers. And you can see the cells and the crimp pattern evident there on the drawing at kind of the 50 to 200 micrometer range. You can start to see that pattern. And all of those together, bundles of fascicles make up the tendon. One thing to note about tendon is that it's not particularly vascular. Tendon is slightly more vascular than ligament, but in general, both of them are avascular, which means, as you can see in this picture here, where the blood vessels have been stained with India ink in a human flexor tendon, that there's just not a lot, especially when you compare it to the bone that we were looking at last week, where each osteon had a blood vessel in it. So blood vessels are very prevalent in bone. There are lots of places, and bone remodels really well. Tendon and ligament have very little vasculature, and as a result, they don't tend to remodel very well. And that's one of the challenges of orthopedic surgery, is figuring out how to repair tendons and get them to grow. One of the ways that people have experimented with that, and that you can sometimes find treatments for, is platelet-rich plasma injections. And what platelet-rich plasma injections are is where you take blood plasma, which has been enriched with a concentrated source of autologous platelets. And what that means is that somebody has a blood draw, and then you take the blood that's drawn, you put it in a centrifuge, you spin it down so that the red blood cells separate down at the bottom, the plasma up at the top, and in between the red blood cells and the plasma, you have this platelet-rich layer. So you take that platelet layer, and then you inject the platelets into the tendon. And the idea is that that is where all of the signaling molecules are, all of the remodeling things are. And so putting that into the tendon, theoretically, will induce healing or stimulate healing. So it's been used a lot of places as a technique in orthopedics and plastic surgery, in nerve regeneration. Its efficacy is a little bit uncertain. There are studies ongoing, but you can have it for quite a bit of money, and you may know people who have had PRP injections, maybe for tennis elbow or for Achilles tendonitis, things like that. It's a pre-surgical intervention that in some cases is certainly tried to help people heal without needing surgical intervention. Finally, as we think about the structure of tendon and ligament, it's important to note that ligaments and tendons insert into bone, ligaments on both ends and tendons at the end away from the muscle. And that happens through a process of ossification through a process of ossification, where you start out with the parallel collagen fibers in this micrograph here, the ligament. This is, in this case, a ligament, but ligament and tendon behave the same. And then those parallel collagen fibers gradually turn to unmineralized fibrocartilage as they get close to the bone. And then they turn to mineralized fibrocartilage. And then finally, you get to cortical bone. And so it's really a continuous process, like the collagen fibrils transform very kind of gradually and smoothly into the bone, which is, again, one of the challenges if you have to replace a tendon or a ligament, of how do you get your graft, your replacement, to integrate with the bone in a strong way. So the mechanical properties of tendon and ligament depend heavily on the structure of tendon and ligament, and we'll talk more about that in the next video. See you there. Welcome to this set.
Okay, so we'll conclude the session today here only, and next day we'll continue from page number, I think 18. No, 7. Yes, skeleton bones, types and structure and function from there, because it's a very big topic. So today we are unable to complete. So page number 17 will start skeletal bones. Okay, Suji, Philomeni.
Okay, sir. Okay, sir.
Okay, so we'll conclude the session with prayer. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, akaschit dukhabhag bhavet. Shanti, Shanti, Shanti. Rub your palms. When it's little warm, gently attach your palm. Thank you. Thank you very much. अच्छा, শিল্পী রাত 9টায়, হ্যাঁ এখন নয়, রাত 9টায় ক্লাস।